Good morning. It's time for that house call with Dr. Andy. He is in the house. And
good morning.
Good morning. We've gotten word that there's a lot of warnings and confusion over attention deficit disorder medications right now. Kind of what's the issue? What's going on?
Well, I started looking into this because several of my patients are taking these medicines, and one of them recently joined my practice, and the mom told me that she had been denied refill of her son's ADHD medicine because the previous doctor said the kid had to come in for an EKG first.
Now, why would they have to have an EKG to be on this medicine?
Well, that's a good question. The American Heart Association recently released a statement that's implied that perhaps kids need to have an EKG machine, or at least that's how it's being interpreted by many primary care doctors. In fact, that's not what they said. What they suggested is that these kids need to be evaluated for heart defects, what we call congenital heart defects. And this evaluation could include an EKG in some circumstances.
Now, why would we need an EKG? Does the medicine elevate the heart rate that much that there's a risk these kids their heart's going to be beating too fast on the medicine? That's
a good question. These medicines do elevate the heart rate and the blood pressure to a certain extent, but in most cases, at the regular doses, it's not significant. The reason is because of a concern of something called sudden cardiac death.
That sounds bad.
It does. It's a very scary sounding thing. It doesn't matter how tenuous the connection is with the ADHD medicines. It sounds very scary. What it is there are approximately 25 people. This is between 1999 and 2003, and a few more people since then. But between 1999 and 2003, for example, over a 4-year period, there were 25 people taking ADHD medicines that died suddenly. And they don't know if it's because of the medicines. They think that there might be an association, but that doesn't mean that it was caused by the medicines. More likely, there was an underlying heart condition that was most likely the culprit. But because of that, we're coming out with these new recommendations finally by the American Heart Association that actually have been out for about a year, but now have been clarified this past spring.
So bottom line for patients is they don't immediately have to have an EKG, but you should always know your heart health whatever age you are.
Bottom line is see your doctor and be evaluated for congenital heart defects. That includes an exam, a thorough history, a family history, and then in some cases an EKG, but they do not recommend an EKG for every child, nor do they suggest that it's even advisable.
So most parents or anybody on HD or medicine right now, they don't need to worry. They can stay the normal course.
Right, and that's a good question. For people already on these medicines, it's a good idea to make sure you talk to your doctor, and I'm certain that your doctor, if they're doing their job, already evaluated you for congenital heart defects. And if they haven't, ask them specifically about it, and I'm sure they'll be happy to answer your questions. But that's something, too.
It's a big, scary issue. Thanks very much for straightening it out. And if you have questions on this or any other medical topic, you can always get a hold of Dr. Andy at 239-694-6246 or Andy at drandy.us. You never know, it might become one of our topics that we discuss here. Dr. Andy, thanks so much.
My pleasure.